The urinalysis isn't really taught super well in a lot of places. And on the other hand, in the world of functional medicine, there's some really interesting things that are said about some of the markers in a urinalysis and what it might indicate. And I will tell you, there's pretty much zero science about some of those things. So what I wanted to put forth was a very basic overview of a urinalysis. Now, I will tell you, it is the oldest chemical test that we have on humans. When you look at the history of a urinalysis and us evaluating it, people always like to talk about how they used to smell it and even taste it and some weird things for sweetness, and ants were attracted to the sweet ones and because the people were spilling out glucose. But for thousands of years, we have been evaluating urine. For hundreds of years, for example, well before blood chemistry was even thought up, the idea of doing a 24-hour urine catch came about, I think, in the 1600s. So if there's we've been doing this for so long, why the heck are we doing a bunch of more modern, recent functional medicine tests to the exclusion of this really basic, inexpensive test, which doesn't tell you a ton, but is a great screening test for some things. We should have this on every single patient on every single time they go to the lab. All right, with that, so here's the deal. I'm going to try, like I said, I'm going to keep this basic, but you can't talk about a urinalysis without talking about where urine comes from in the kidneys in the first place. Now, I've said it before, I'll say it again, and we haven't done level 2B at the time of this recording, but the kidneys are amongst some of my most, they're not my favorite organ or system, just because everything's cool. But while everybody's talking about the immune system, which is amazing, and the nervous system, and people love the liver because of all the 300 plus things that it does, nobody really ever talks about the kidneys. And I will tell you, I am probably in more awe of the kidneys than I am any other organ in the body. The heart pumps, the liver filters and stores and makes and does all these things. But the kidneys, I will tell you, when you look at the things that they actually do, and how they do it, and how they're the least sexy organ in the body when you know the liver and the heart and the brain and all these things, but yet they just get no love, and it doesn't matter. They do what they do, and they continue to do it for a very long time. And as I've said before, they have to be in pretty bad shape before they even indicate there might be an issue with them, which is why a urinalysis is so important.